Jurgensen's test for the biceps. So first you want to palpate the biceps tendon by internally and externally rotating the shoulder. You want to stabilize at the elbow, and the patient starts in a prone position and they're trying to supinate and externally rotate. So perform that action and I'll resist you. Good. A positive would be weakness bilaterally or pain and clicking in the biceps. Speeds test for the biceps as well. So you're going to stabilize at the shoulder, make sure the patient is supine, and they're going to actively flex their shoulder as you resist, and you're palpating the biceps tendon, and a positive would be clicking in the biceps or pain. The empty can tests for the integrity of the supraspinatus. So you want your athlete to abduct to 90 degrees and horizontally adduct about 30 degrees, stop right there. Make sure their thumbs are pointed down, the empty can. And you're going to resist them. They're going to try to stay where they are. Resist me? Good. A positive would be weakness compared bilaterally or pain. The lift-off test tests for the integrity of the subscapularis muscle. So the first part of the test is to just see if your patient can put his or her hand on her low back. And if they can't complete that task, then that would be a positive, and you wouldn't continue on with the test. But if they can do that, the next step is to resist them as they try to lift their hand off their back. So you want to place your forearm on their forearm, keeping their elbow in, and stabilizing at the shoulder, and they're going to lift off. Good. And you resist them. A positive would be weakness or pain. Okay, apprehension test is one of the first GH instability tests you should do in a shoulder eval. And its action is to mimic a subluxation of the shoulder. So you want the elbow at 90 and the shoulder at 90. And you're going to slowly externally rotate their shoulder. And this would cause pain. And you're supposed to watch their face to see if they have any signs of apprehension. The relocation test is one you want to do right after the apprehension test. So you bring your patient out to 90 and stabilize their arm, and you want to externally rotate them until they have pain. You name, okay. And you internally rotate their shoulder, and this should relieve the pain. A positive, if the pain goes away when you internally rotate, it would be indicative of a subluxation. Sulcus sign tests for glenohumeral instability, and you're looking for a sulcus in between the acromion and the humerus. So you want to stabilize your patient at the shoulder and hold just distal to the olecranon, and you're going to pull downwards, looking for that sulcus in the shoulder. And a positive would just be the sign of the sulcus, indicative of glenohumeral instability. The anterior and posterior drawer test also tests for GH instability. So you want to stabilize at the shoulder, and you're going to move the humerus anteriorly and posteriorly. A positive would be laxity in either direction, indicative of GH instability. The grind test tests for the integrity of the labrum. So you want your patient lying supine with their shoulder close to the edge of the table. You can have them grab onto your arm for support, and you're going to forcefully push the humerus up into the shoulder and grind like that. A positive would be clicking or popping or pain anywhere in the joint, and it'd be indicative of a labrum tear. O'Brien's test also tests for the labrum, and there's two parts to it. First, have your patient put their elbow in front of their nose. You're going to stabilize at the shoulder, and you're going to force them down, and they're going to resist you. A positive would be pain, and then you flip them, pull them up, stabilize at the shoulder, force down again, and that should relieve the pain. If both of those occur, that would be indicative of a labrum tear. Neer's test tests for impingement in the shoulder. It's a completely passive test. You stabilize at the shoulder, internally rotate the shoulder with the thumb pointing down, and bring their shoulder up in deflection. And then a positive would be pain in the shoulder.